Okay, hello and welcome to our webinar Wednesday. Today is May 26th, 2021, and we are talking about skin cancer in recognition of Skin Cancer Awareness Month. Just as a reminder, for those of you who are joining us on Zoom, please make sure that you remain muted when not speaking. We are streaming this live to Facebook and recording it, and we will be putting it on our YouTube channel as well. If you are on Zoom and have any questions, please use the chat box function. For those of you on Facebook Live, please use the comments feature on Facebook to ask any questions throughout the presentation, as we will have some time at the end for Q&A with our speaker. This Webinar Wednesday series is part of the community engagement efforts of the University of Chicago Comprehensive Cancer Center, Office of Community Engagement and Cancer Health Equity. My name is Aaliyah Poulos, and I'm an education outreach specialist in this office. I'm joined today by my colleague, Erica Rodriguez, who is our Latinx outreach specialist. So for those of you who are on our Zoom who may have questions that come up during the presentation, you can feel free to direct message Erica or myself. Our office is the community engagement arm of the Cancer Research Center at the University of Chicago, and we are tasked with bringing faculty expertise to the larger U Chicago community and the communities that we serve in and around the U Chicago area. So thank you all for joining us today as part of our community education efforts. Today's speaker is a dermatologist and assistant professor at the University of Chicago Medicine, Dr. Angad Chadha. And Dr. Chadha, I am going to stop sharing my screen so I can throw it to you and you can begin our presentation today.
Sounds good. Thank you. Hey, everyone. Let me just start my screen share. And we're having some issues with the presentation, so I think we'll just kind of leave it in this mode if that's okay with everybody. So yeah, I'm an assistant professor of medicine in the section of dermatology here at the university. I focus mainly on inpatient consultative dermatology, so people who are admitted with severe blistering skin disease and severe drug rashes. I also focus in supportive oncodermatology, so managing side effects of chemotherapy and radiation and stuff from treatment of various cancers, lung cancer and everything, not just skin cancer. But I'm super glad to be here today to talk to you guys about skin cancer and, more importantly, how you can prevent skin cancer and sun protection. And we're going to keep it really general here, not too crazy. And I should warn you, no dermatology talk is complete without some images, and some of these images are just basic little bumps of cancer, and then some of them are a little bit more graphic, so I'll give you a little heads up if you're a little squeamish and you can close your eyes for a second or something. So let's kind of get into it. And it's tough to do audience response in Zoom, so maybe I'll be my own audience. But so a couple of true or false questions. So skin cancer is rare. Unfortunately, this is false. Skin cancer is perhaps one of the most common types of cancer in the country, and we'll take a look at some numbers a little later. Melanoma is not dangerous. Unfortunately, this is also false. Melanoma is perhaps one of the most dangerous type of skin cancer, because oftentimes we don't catch it until it's a little too late, or it kind of grows more aggressively than other cancers do. Tanning at an indoor tanning bed is considered safe. I would hope everybody would say false to this by now, though 20 years ago people thought it was totally safe. So this is very, very not safe, and we'll talk about why. Indoor tanning beds can help clear up acne and make scars fade, which is again stuff people thought like 10, 15 years ago. But this is also unfortunately false. If you have scars, they can actually maybe be made worse by tanning, because it can make the normal skin around it a little darker, whereas the scars stay a little light, and we'll touch on that. Indoor tanning can cause wrinkling and sagging of the skin and faster aging of the skin. And this is absolutely true. Tanning, the sun has two types of ultraviolet rays, which we'll talk about, but UVA rays are the ones that sort of lead to sun-induced aging of the skin. So if you tan, not only are you putting yourself at higher risk for skin cancer, but you're also putting yourself at higher risk for premature aging of the skin. And everyone wants to stay younger looking longer, so tanning is not great for that. Putting on sunscreen once a day, just in the morning, is enough to protect you from the sun all day. Unfortunately, also false. Sunscreen probably only lasts maybe 2 or 3 hours, and we'll talk about why and what you can do to help mitigate that risk. More than 1 out of 6 teens have used tanning beds, despite the fact that the tanning age is like 18 in most states. Unfortunately, this is true. People start tanning early, and they keep tanning. I have patients in my clinic who still tan because they like the way it feels. And I tell them very bluntly, if you keep doing it, you will get a cancer someday. the amount of sunscreen you use does not matter as long as you use it. As long as you put some on, it's better than anything. Yes and no. Putting some on is probably better than anything, but it's false that the amount doesn't matter because you really do want to get a sufficient amount on there, and we will cover what a sufficient amount is, quote unquote. You don't have to wear sunscreen on cloudy days. Living in Chicago, we get a lot of cloudy, rainy days in the spring and the fall. We get a lot of cloudy, snowy days where you're like, oh, there's no sun out. So does that mean you don't have to use sunscreen on those days? Unfortunately, that's false too. You got to use sunscreen on those days. Even if the light's not getting in through the clouds, the ultraviolet rays are still getting in, and they're still hitting the skin. Getting a base tan, so going to the tanning salon or going anywhere just to get a base tan every once in a while will prevent you from getting sun damage. That is false. It can maybe sometimes help with things like sunburns, but it will not help you with skin cancer and actually make your risk of having skin cancer a little higher. We'll touch about that. So again, why are we all here? As I mentioned, skin cancer is the most common cancer type in the United States. 20% of Americans at some point will develop a skin cancer in their lifetime. And all of us, regardless of skin type, if we live long enough, will get a skin cancer because we are constantly being bombarded by ultraviolet rays from the sun, no matter where you live or how much you go outside or if you're light-skinned or dark-skinned. There's more than 3.5 million cases of skin cancer every year in the United States, of which the majority are non-melanoma skin cancers, so basal cell cancer and squamous cell cancer, and we'll take a look at what that means. A small fraction are melanomas, and that's probably the one that we worry about the most. And it's estimated that 1 out of every 7 of these skin cancers are due to tanning bed use. So there's a direct correlation between increased tanning and increased skin cancer. And usually what we quote is a number of about 10 tanning bed uses. If you've been to a tanning bed 10 times in your life, your risk of skin cancer and specifically melanoma is about 10-fold higher than the next person over who has not had any tanning. So definitely not the great idea. Now, melanoma, of course, is preventable because a lot of this is related to ultraviolet rays. So if we prevent ultraviolet damage, we can help prevent the cancer. And unfortunately, it's very common very early on because if you start tanning in your teenage years, you're going to start seeing cancer in the skin in your mid to late 20s. And sadly, a lot of our younger population has increasing skin cancer, again, because people are doing things like tanning, either at tanning beds or, out in, at the beach or whatever, because they want to look nice. And people don't use sunscreen appropriately, and that leads to earlier and earlier skin cancer. So it's not necessarily always a condition of older patients. So let's do some basic stuff. What is the skin? So your skin's got 2 layers. Up top, you have your epidermis. That's the part that you can see. That's the outside part. And then underneath it, you have your dermis. And the epidermis has a couple of different layers, and we don't necessarily have to get into it. But the bottom line is at the bottom of the epidermis, you have melanocytes. And these are the cells that make skin color. That's what makes your skin, brown or black or anything like that. And then you also have a bunch of stem cells, and that's what produces the rest of your epidermis continually, because your epidermis turns over every like 21 days or so. Underneath that, you have your dermis, and that's where all the blood vessels and nerves and stuff are. And then underneath that is where all of the fat and bones and the cartilage and muscle is. So just to look at this a different way, up here you have your epidermis. It's very, very thin. And at the bottom where these little like black dots are, that's where all your melanocytes are hanging out. That's where the melanoma comes from. And underneath that, you have your dermis. That's where all your hair hangs out and your blood vessels and nerves. And then below that, you have your subcutaneous tissue or your fat, under which is all your muscles and everything. So what is skin cancer? Cancer, as we all are, I'm sure, aware because we're all here on this webinar, is an abnormal growth of the cells in your skin. And of course, the skin cancer comes from skin cells. And if it's coming from a type of cell called a keratinocyte, which is like the structural cell of the skin, then you get a basal cell or a squamous cell. And if it comes from the skin color cells, the melanocytes, you get a melanoma. And what's happening here is that these cells are mutated. So they're growing much more quickly than normal. They're growing much more aggressively than normal. So they're not really respecting their neighbors and they're just kind of doing their own thing. And then when they don't respect their neighbors, they start to destroy all the local tissue in that area because they just grow and grow and grow and grow, kind of like bulldozing through everything. And they bulldoze through skin, they bulldoze through blood vessels, and then they can enter blood vessels and travel through the body or metastasize. The 3 main types of skin cancer, and there's a lot of other types as well that are super rare, but the 3 big ones that we see commonly are basal cell cancer, which is by far the most common, happens at the bottom part of the skin. Squamous cell cancer that also starts in the epidermis, and the melanoma, as we talked about, starts with the skin color cells, the melanocytes. So what increases your risk of skin cancer? And we've already touched on this, and a lot of this now because the New York Times runs papers on this every single year. But again, 10, 15 years ago, people just weren't as cognizant of this as we are now. So genetics, of course, have a huge role in it. If you have lighter skin, you're a little bit more risk of skin cancer because your body's not as great as adapting to sun exposure. More than anything, though, exposure to ultraviolet rays is by far the highest risk activity. And that comes in many different forms, right? We've talked about tanning already, but also just basic sun exposure. So getting a lot of intense sun exposure from the sun, specifically if it's intense enough to cause really bad burns, like blistering sunburns, is a huge risk for skin cancer. And then for some patients, radiation can also be a risk, like people who fly a lot, like pilots, and then people who are getting radiation for treatment of other cancers. So let's kind of get into a few different types of skin cancer. So basal cell cancer is the most common one, caused by ultraviolet damage. And this usually shows up somewhere on the face, typically, though it can be anywhere. And this is caused by ultraviolet damage to the skin. It presents as like a pink, kind of like shiny or pearly bump that does not go away on its own. Occasionally, it can also bleed and kind of break down. And so there's going to be some photos on the next page, not too graphic, but these are just going to be these kind of like pinkish, kind of shiny bumps that show up on the face and they don't go away. And sometimes they can have a little bit of color in them. And sometimes, like here on the nose, they can kind of like ulcerate on their own. The next page is going to have maybe a few more graphic photos where, if you leave these cancers untreated, what they do is they just kind of start destroying everything in their path. So here you can see this cancer is starting to eat its way through this dude's nose. Here, this unfortunate lady has a very large one on her neck, and it's just kind of radially expanded to eat up most of her skin there. And then here, this patient has one that's kind of stuck onto her skin, just given the largesse of that cancer. So moving on to squamous cell cancer, this is the next most common type that we see. And when I say common, I see at least 4 or 5 basal cells a week, at least maybe 1 squamous cell cancer a week, and I would say melanoma maybe once a month. So these are not rare at all. So squamous cell also typically occurs on sun-exposed skin, is usually because of sun damage. And instead of like the basal cell that shows up as like a kind of like a shiny bump, these look more like just like a red scaly patch that just does not heal. And again, these can bleed and ulcerate as well. So kind of looking at this, here, this lady just has kind of like a red scaly patch on the nose that's not going away, probably growing. In biopsy, it comes back as a squamous cell. Squamous cell is a little different from basal cell. There's a lot of different subtypes to it. So sometimes it can be kind of like a bump that doesn't go away, or a bump that has a lot of like crusty gunk in it. You don't necessarily have to, bother yourself with all these things, but the long and short of it is, if there's a new bump that looks kind of funky and it's not getting better on its own, definitely have someone take a look at it. Or if you see one on your grandpa, or you see one on your aunt, and you're like, hey, aunt, why is that not going away? Tell her to go see a doctor. A few more kind of graphic images of squamous cell. These can occur kind of anywhere on the body, unfortunately. So we see them on the bottom of the feet. We see them on the face here. This is a quite an extensive one. And then they can occur on the fingers, toes. They can kind of destroy the finger in the area. And even if this doesn't travel through the body and the patient as well, obviously this is still very disfiguring and problematic to the patient, because you can imagine having to do a whole surgery on the side of the face is going to be quite an ordeal. Last but not least, melanoma is probably one of the more rare types of skin cancer, but definitely the most dangerous one, or one of the most dangerous ones. This can happen anywhere. It can show up on normal skin on its own, or it can occur within a pre-existing mole. Typically, it happens on normal skin kind of on its own. And these can happen anywhere on the skin. They can also happen inside the mouth. They can happen in the genitals. They can happen at the back of the eye. And then in patients with skin of color, so South Asian patients, African American patients, we do see it pretty commonly or most commonly on the hands and the feet. So here, we'll talk about the signs of melanoma, but this is going to be like a very darkly colored spot because it comes from the skin color cells. That's going to be very funky looking. It's not even. It's got a lot of parts to it. It's often growing very quickly, much quicker than anything else normally should grow. And a few other photos here on the next page. You can have them in the nail bed, kind of in the nail plate here. As I mentioned Previously, you can get them on the sole of the foot, and occasionally you can also have them in the eye. So if you're seeing like a really dark mark anywhere on your body or a friend or family member's body that seems to be growing and it looks kind of funky and it's got some weird borders, have someone take a look at it. Now, what happens if you don't treat melanoma? Melanoma will metastasize and it will go crazy and it will spread all over the skin. It'll spread through the lymph nodes. It'll spread through the body. Generally speaking, there's like little subtypes that don't do that, but traditionally melanoma is considered to be fairly aggressive. So, brief word on what we do for treating skin cancer. So a lot of the times, squamous cell cancer and basal cell cancer, luckily, and even melanoma most of the time is just in the skin, and we can just cut it out, be done with it. And the pathologist looks at the tissue and they tell us, hey, the cancer's gone, you're good. Sometimes though, if the cancer is really extensive or it's traveling inside the body, we do use different chemotherapies for it, either like a chemotherapy cream that you rub on the cancer or systemic chemotherapy, through the IV, like the oncologist would help us manage. And occasionally patients also need some radiation to help shrink some of the tumor sizes if they're too big for surgery. I did want to just take a brief moment to give you like a preview of what it takes to cut a skin cancer off of someone's face. Because if you imagine cutting something off of a back or a belly, you've got a lot of extra skin there. You can just kind of lop it off, close it up, and the sutures will look fine. However, there are some on the face, which is where we see most of the skin cancers. There's not a lot of extra room, so you can't just cut off a large piece of tissue and stitch it closed. So we have to get pretty inventive with it, where we take small pieces of tissue, move stuff around the face to get the defect closed. So I do want to show you a photo, and this is going to be a little bit more on the graphic side. It is a surgical image, so if you're a little queasy, maybe don't look at it. But this lady unfortunately had a large tumor on her scalp, and this is clearly something that you can't just close, right? You can't just like bring that skin together because it's going to raise her eye up or like bring the hairline down. So what the surgeons here actually had to do was borrow a whole bunch of skin from the side of the forehead and move a flap into place. So they cut off all of that skin, move it into place, and suture it in closed in like an L shape. This comes together really well. I mean, you can almost not even tell that she had surgery, but clearly a very like traumatic operation. You're stuck in the OR for a while, or in the operating room for a while. The recovery is not the greatest, and surely not an experience anyone would volunteer to go through. Let's have a brief word on tanning. So, why do people tan? People tan for all sorts of reasons. I have a gentleman who moved here from Florida, and he says that he really misses looking how he did when he lived in Florida, so he likes to tan. And I told him he's going to get cancer if he tans, and he's like, no, it's like I'm okay with that. Like I just really like to look brown and feel warm. People think that it kind of helps with certain health benefits, like helping fade scars and stuff, which it does not. Or, they think having a base tan helps to prevent cancer, which it does not. The base tan actually probably makes cancer worse. Unfortunately, like media and society seems to think that a tanned, more brown skin is more attractive for whatever reason. And so people kind of look for that and they try to model that, whatever they see on Instagram and TikTok and stuff. And then there might be some element of peer pressure, especially for younger kids. If your friends are tanning, you might want to tan as well, just to sort of seem cool. Now, we talked a little bit earlier about the types of ultraviolet rays. So you have UVA rays and UVB rays, also UVC, but UVC doesn't make it to the Earth. They're both present in the sun and they're both present in tanning booths. The UVB causes burning, and the way I remember is B causes burning. And then that's the one that causes skin cancer. UVA causes aging, A for aging. That's not why they were named, but that's how I remember them. And that's the one that leads to breakdown of collagen in the skin, and it leads to photoaging of the skin. So it makes you look older at a younger age because of sun damage. If you get in a tanning bed, the amount of exposure that you get to ultraviolet rays is so intense that just 15 or 20 minutes in there is equivalent to like a whole day sunbathing. So I'm not saying one is better than the other. I'm saying don't do both. The damage that's done to the skin cells is permanent. Your body tries to do a little bit of housekeeping and tries to take care of that damage, but there's always going to be a little bit that gets away from it, and that's the stuff that leads to skin cancer. We already talked about this earlier, but an overwhelming number of skin cancers are linked to tanning. I'm not going to go into the numbers again. And the earlier you start tanning, the earlier you get cancers. And I think that kind of makes sense to everybody. So how to protect yourself from getting skin cancer? The main thing is going to be to avoid ultraviolet rays. So either from the sun or from tanning beds. You don't want to get wrinkly quick. Everyone's always trying to like look young longer. You don't want to get sunburns, and you don't want to increase your risk of skin cancer. When the sun or tanning beds damage your skin, the damage that's happening is on like a biochemical level. So you're not even seeing the damage until years after it's already been done. So even if you go out, today and you get a little bit of sun, and you're like, oh yeah, I'm a little pink, but it doesn't look that bad. That could come back to haunt you 10 years from now. This is just a ultraviolet photography of this person on the left. Looks pretty normal. Looks like an average person you would just see her walking down the screen. But then when you light her face with ultraviolet light, you can see all of these little precancerous areas on her face that are preferentially uptaking UV light, and this is a problem. So there's unseen unseeable damage underneath the level of the skin that we cannot even see until it comes out and starts to create problems. And then besides sunscreen, what else can you do for sun protection? Stay in the shade between 10 a.m. and 2 p.m. So that's when the sun is at its highest. That's when the ultraviolet rays are at their highest. If you like to get into technical stuff, you can always look at the UV index and go out when the UV index is low and stay inside when the UV index is high. You want to apply sunscreen at least SPF 30 or higher, and we'll talk about why that number matters. You want to put it on 30 minutes before you go outside so that it has time to kind of soak into the skin. And you want to reapply it every 3 hours if you're going to be outside for a long period of time. So if you're at like a picnic or a beach day, or you're running errands all day and you're in and out of the store or farmer's market or whatever, you want to make sure that you're reapplying sunscreen every 2 to 3 hours. And as much as possible, try to wear sun protective clothing. So, if it's a cool day outside, wear a long sleeve shirt. That way you essentially just protected your skin without even doing anything about it. A lot of activewear companies make clothing that has UPF or universal protection factor built in, and it's basically like SPF in clothing, but it's activewear, so it helps. It breathes well. You can wear it, while you're swimming at the beach. You can wear it while you're playing tennis on the tennis courts. It's designed for you to get sweaty in, but it also protects you from the sun more than just like a cotton t-shirt would. So shade is super important. Always try to seek shade, especially between 10 and 2. And then sun protective clothing, which we just talked about. So two of the brands that I really like are Coolie Bar and Solumbra. They make fantastic activewear. Sometimes looks a little dorky like these hats, but they also have some phenomenal, just like regular activewear that you would, you'd be fine with wearing. That said, the brand just does not matter. So if you go to any like exercise store, you go to REI or anything like that, and you find activewear that you like that has UPF built in, go for it. The brand does not matter. Now, what are sunscreens? So sunscreens are compounds that do one of two things. They either absorb the sun rays and neutralize them, or they take the sun rays and they bounce them right off your skin. And they come in a lot of different forms, right? There's creams, there's lotions, there's sprays, there's those like rub-on sticks. I'm going to tell you right now, the creams and lotions are the way to go. That is the only way that you're going to be able to get a sufficient concentration of sunscreen on your skin. The spray and the roll-ons just aren't going to do it. And then just putting sunscreen on is better than not putting anything on. But if you're going to go the extra mile or go the mile to put sunscreen on, make sure you're putting on enough. That way you're getting the maximum amount of protection, because you really do need about a gram per body part. We'll talk about that. What does SPF mean? You've seen these, right? SPF 15, 30, 46, 50, 80. So SPF stands for sun protection factor. And what this means is that it's a measure of how much longer it'll take you to burn if you use the sunscreen. So for example, let's say we have a guy named Tom who is very, very light-skinned, and he usually burns in 5 minutes. So if he's standing in the sun for 5 minutes, he's going to get a pink skin within the next day. If Tom starts to use SPF 30 sunscreen, it increases his time to burn by 30. So his time to burn goes from 5 minutes times 30 to 150 minutes. So that sounds like a pretty good deal, right? He's going to get like 2 or 3.5 hours worth of protection out of this sunscreen. We also talked about the fact that sunscreen needs to be reapplied every 3 hours because it either gets used up or it rubs off with your clothes and stuff. So if you're getting SPF 30 at the very least, and you're reapplying it every 3 hours, you're kind of in a good zone. the gain in protection between SPF 15 and 30 is huge. You go from blocking something like 90 to 93% of ultraviolet rays up to like 97, 98%. Now going from 30 to 50 or 30 to 80, you're going from like 97 to 99%. So it's still maybe worth it, but at the very least, I would say SPF 30. So everybody should use sunscreen daily. I know a lot of patients with skin of color, myself included, probably play fast and loose with sunscreen because we are overall lower risk for skin cancer, but we're not lower risk for aging. Everybody ages, and the sun will cause you to age faster through the UVA rays. So if you use sunscreen, you will look younger longer. And if that's not enough to convince you, I don't know what is. You want to reapply it every, I say on average about 3 hours. And if you're like, going in and out of the pool, in and out of the ocean, or you're outside like playing tennis or something, and you're just sweating up a storm, you definitely want to apply it a little bit more frequently because it's going to get used up. And then even in the winter and on cloudy days, unfortunately, like I mentioned earlier, sunlight's not getting in, but ultraviolet rays are still getting in through the sun. And if you're in a situation where you've got clouds above and snow on the ground, the ultraviolet rays are now bouncing around between the clouds and the snow. They're reflecting. And you're increasing your exposure, even though the UV rays are only coming in once. Because on a regular sunny day in the summer, the UV rays come through, they get absorbed by the ground, and it's done. In the winter, they can't get absorbed by the ground, they bounce around. This also kind of explains the fact why a lot of the Scandinavian countries have very, very high rates of melanoma, even though they're super dark and super snowy all the time. It's because the UV rays get in there, they bounce around, and it almost creates like a little bit of like an ultraviolet hotbox. What are the types of sunscreens? So there's chemical blockers, and then there's physical blockers. And actually, you know what? I've got the numbers, the words exchanged here. So inorganic sunscreens are the chemical blockers, and the organic sunscreens are the physical blockers. My bad. The chemical blockers are the ones with like the fancy chemical names, and what they do is they absorb the sun and they diffuse the ultraviolet rays, and they spit it back out as low grade radiation that doesn't hurt anybody. The physical blockers like zinc and titanium, what they're doing is they're literally just taking the sun rays and they're bouncing them off. Now, people love using the chemical blockers because these tend to go on really smooth on the skin. They don't leave any residue. And then the physical blockers traditionally were a little bit thicker and pastier. As you can see here, I've got probably like a zinc sunscreen on my face. You can see that kind of whitish residue, which is a problem for patients who have skin of color like myself. However, a lot of the newer zinc and titanium sunscreens, especially from some of the higher end brands like Ulta and Tizo, and I don't represent those companies, but I do recommend them to my patients, have such elegant formulations of these sunscreens, and they also have a tint in them that makes the sunscreen kind of brown looking, that brown people like myself can put them on and you can't even notice it. So there are ways to get around it, and I'd love to give you guys more info on that if anyone's interested. So which one of these is the right amount of sunscreen for your face? And I think by this point, we're all good test takers, and we know that the larger is always better. So it's number 2. What's the goal here? The goal is that when you're outside and you're applying sunscreen to your whole body, you're going to need at least an ounce to cover your whole body, and that's about a shot glass, roughly, maybe half a shot glass. And what the easy rule of thumb here is use your fingertip units. So you need about 3 fingertip units worth of sunscreen for your whole face. You need 7 for a larger area, like your entire front side or your entire back side. Maybe 6 or 7 for some of the medium-sized areas, like your legs and your arms. And then maybe just 1 for your hands. So if you think about this, I guarantee you, I would love to know if somebody in this talk is actually using the appropriate amount of sunscreen here. But my gut tells me most of us are squirting a little bit out and then using it all over the whole body and just calling it done, which is better than nothing. But if you're already going through the trouble of putting on sunscreen, just put on the appropriate amount. Now, a couple of words on moles themselves and what you should look out for and what things, what should tip you off to like, hey, maybe I should get this checked out. Everyone has moles. I'm sure if you looked at your arm right now, you'd find at least one. And these can range from kind of pink to light red to light tan to dark brown to straight black. They can be totally flat if they're just in the top level of the skin, or they can be raised if they're a little bit deeper and they're pushing the skin up above them. Some of them, especially ones that you've had your whole life, will have like hair coming out of them. Most moles basically never ever cause a problem. I'm sorry about that typo there. However, if you're noticing a mole that you've had for a while and it's starting to change, like it's got new funky colors in there, it's growing, it's bleeding on its own, have someone take a look at it, have a physician take a look at it. So things to look out for with your average mole and things that should tip you off to, hey, there's something not right here, are kind of what we call the ABCDEs of melanoma. So if a mole is asymmetric, it means you can't fold it on itself and it doesn't match up, that's a problem. If a mole has weird borders, so it's not like a nice even circle or an oval, it's got like weird arms and legs coming out of it, that's a problem. If it's got multiple colors, if you got a mole that's just straight brown all the way throughout or straight pink all the way throughout, probably okay. If you've got one that's like half brown, half pink, or half brown, half blue or gray or something, that's a problem. Have someone look at it. If it's larger than 6 millimeters, have someone look at it. That's not a surefire thing. Clearly there's people who are born with moles that are like a few inches in size, and that's never a problem, but it's always nice to have someone just double check it. And then the most important one is if things are changing. So if you've got a mole that's been quiet and hanging out for a while, and all of a sudden now it's got new colors in it, or it's growing an arm, or it's now asymmetric, have somebody take a look at it. So what can you do to sort of protect yourself and your family and your friends? Because I'm sure you will share all this information with all of them. Talk to them about sun protection. Remember the fact that you want to use SPF 30. You want to apply it every 3 hours. You want to put it on all of your sun exposed areas. Remember the fact that you want to use like an ounce, like that much sunscreen to cover your whole body, which is a lot of sunscreen. If you've got a bottle, that means you're going to go through a bottle within 2 or 3 weeks if you're using it every day. And if you do have a lot of moles, follow up with a dermatologist regularly. We are glad to help to take a look at things and triage things. And I think these are a few of our takeaways. Don't tan. Melanoma is common, but it's preventable. We should catch it early whenever possible. Stay in the sun between 10 a.m. and 2 p.m. because that's when the sun's at its worst. Apply sunscreen. It'll prevent skin cancer. It'll prevent aging. And then try to wear sun protective clothing if you're going to be outside and active. And I think with that, I am going to wrap up my slides, and I'd love to take any questions if anyone has them.
Okay, thank you so much for all that really great information. A little freaked out, not gonna lie, but this is really great for prevention. And man, those images, that's powerful stuff.
Well, I didn't know if it was going to be too much, but
No.
you can't come to a dermatology talk without seeing a couple of gross images.
No, nothing will spur me more to start wearing sunscreen more regularly than seeing some of these. So I'm gonna go. I got questions of my own. We've got questions in the chat, and I'm sure more will come up. So I'm gonna start with the first question in the chat that we have here. It says, "Can you talk more about how sun protective clothing works? Wouldn't any opaque clothing protect your skin from the sun?"
Yeah, so it's a great question. Any thick, opaque clothing, especially if it's layered, will for sure protect your skin from the sun. Sun protective clothing has compounds in it that, again, will diffuse, neutralize, or reflect sun off of you. Just a basic cotton shirt is definitely better than nothing. There's no question about it. But cotton is a very porous material, and sun, light gets through there. The ultraviolet rays, their wavelength is so small, it'll pass right through any holes in the cotton. So while it's better than nothing, it's not ideal. And if you are someone who's at high risk for skin cancer or high risk for burning, I do think it's worth it to maybe go that extra step and wear active UPF active wear, especially for times when you're going to be out all day at the gym. And I'm not saying you got to wear these for a run to Target, but if you're going to be lounging at the beach all day, or it's a pool day or something, definitely think about it.
Great. We have a question here. If a very freckly person has some moles and is going to the dermatologist every year to get their skin and moles inspected, is that enough for monitoring? This person says, "I've been told by my dermatologist that this is what I need to do, but it is hard not to worry because I did go to a tanning bed once in high school." I too have a question about this. I used to live in an apartment building that had a tanning bed built in, and I went basically every day for like years. No. So yeah, go ahead and talk about that if you could.
Well, sure. So we have an agency in the United States run through the government, the United States Preventive Services Task Force, USPSTF, that puts out guidelines for how patients should be monitored for various cancers like prostate cancer, breast cancer, and colon cancer. the USPSTF has not actually put out any firm guidelines on what is appropriate screening for skin cancer. So there's no guidelines of everybody should come in once a year to get skin checks, et cetera. If patients have a history of skin cancer, we always, always, always recommend yearly skin checks. For patients who do not have a history of skin cancer or yet or ever, generally my approach to these patients, and every doctor is a little bit different, is get a baseline exam with a dermatologist and kind of get their opinion on how often do they think that you should come in. And of course, you'll check your body at home as well, look in front of the mirror once a month or so and make sure that there's nothing new growing or changing. But the dermatologist can kind of help you figure out like, hey, you have a lot of freckles, but not a lot of moles, because there's a little bit of a difference there. Freckles are not cancerous or precancerous, but moles can be a problem. Where if you got a ton of freckles but no real moles, that's probably not too much of an issue. Whereas if they look at you and they're like, hey, you got a ton of moles and there's like a decent amount of sun damage on your face and your neck and you are high risk for skin cancer, then they might recommend that you come in once a year, even without a prior history. I know I have a number of patients in my clinic who are a little bit on the older side, like 60s, 70s, 80s, who come in yearly, even if they, don't have a history of skin cancer because their friends have had it and they don't want to go through it when they don't want it to sort of get bad. So I know that's a non-answer answer, but I would say I'm glad that you've already seen the dermatologist once, and you should ask their thoughts on, hey, should I come in yearly, every 2 or 3 years, or just as needed?
And sort of following up on that question too. That was a question asked by someone else, but I had a similar concern. And so I went to a dermatologist recently about this from like my first time, and she goes, "Oh, I think all your moles and freckles look fine." Again, having been in a tanning bed hundreds of times. So that picture with the UV where like the person kind of looks normal and then you had the UV where you saw all those sunspots, was that just like a cool photography project, or is that an actual tool that is used? How can I get that? I guess is the question.
I think it's like a research thing. That's not something that we use clinically at all. But yeah, I mean, if you've been to a tanning bed hundreds of times, and you were my patient, I would say once a year, you got to do it.
Okay, thanks. Sorry to make this very personal about me, but
no, it's fine.
God knows I'm freaking out a little. Okay, my next question here is: has there been research done to identify and treat precursors for melanoma and other skin cancers, given the damage that is done on a biochemical level?
Yeah, so there is basal cell cancer doesn't really have a precursor. It shows up and it's there. Squamous cell cancer does have a precursor lesion. We call it actinic keratoses, and that is something that dermatologists often see in the clinic. And when we see it, we freeze them with liquid nitrogen. So we kill them on that day. That way we stop them from turning into squamous cell cancer. And that is one of the benefits of doing yearly screenings, especially as you get a little older. And then there are, precursors to melanoma that's an area of hot academic debate that I necessarily cannot get into. But long story short, a lot of melanomas show up on their own without any precursor lesions. And of course, there's nothing that we could have prevented if it shows up out of its own. Now, some melanomas do show up in existing moles, and we know that when we biopsy some of these moles before they've turned into melanoma, we'll looking at it on a slide, it'll be a little atypical, but not enough to call it melanoma. So there is certainly precursor lesions. And we do have a specialty clinic here at the University of Chicago for patients who have hundreds of moles. And we have 2 doctors who specialize in looking at them very critically and figuring out which ones are the pardon my language, but the most weird ones, and making sure that they pick those off before they turn into something problematic. Now, there's like a lot more nuance to it, but yes, there is a lot of research being done in the prevention of formation of advanced skin cancer.
Great. Another question here, and I don't know if you'll be able to answer this one. It says, can you use like an FSA, a flexible spending account, or a health spending account on sunscreen? I don't know.
I don't know the answer to that question, though I know recently I was buying an Ace wrap on Amazon and it gave me the option of using my Flex account. So maybe sunscreen you could also buy through there. So I don't know.
What was that you were buying?
I was like an Ace wrap, like for a sprained ankle.
Oh, okay. Okay. All right. Worth trying.
Yeah.
Oh, and then what were the recommended sunscreen brands again?
Okay, I love this question because there are no recommended sunscreen brands. I don't care what brand it is. No dermatologist cares what brand it is, as long as it's SPF 30 or higher. And then the differences between brands really just comes down to how each one feels. So you're going to have really solid sunscreens made by really basic brands like Coppertone and Aveeno and Cetaphil and stuff. And then you'll have sunscreens with the same ingredients that are made by brands like La Roche-Posay and Elta and Tizo that are going to be 5 to 10 times the price. And those are going to feel better on your skin. So it just kind of comes down to which ones do you like the feeling of, how much money do you want to spend? But at the end of the day, if a sunscreen has zinc oxide in it, it has zinc oxide in it, and it does not matter what company it comes from.
Okay. And did you have recommended, you'd recommended UPF clothing brands, I think, or just that you happen to like?
Yeah, there's ones that I like. There's one called Coolie Bar and Solumbra. But again, the brand just does not matter at all, as long as it's got the appropriate protections built in.
Okay. And then with the UPF clothing, does laundering or machine drying the sun protective clothing remove protective compounds?
I honestly, I'm sorry, I don't know the answer to that question, though I'm certain that that clothing probably comes with like a care instructions or something. Yeah,
Sure. I've got a question here. What about babies? Can I use the same sunscreen that I use on myself on my 1.5-year-old?
for sure. For babies, I always like to recommend the organic physical blocker sunscreens like zinc oxide and titanium dioxide, because the chemical ones like avobenzone and oxybenzone can sometimes be a little irritating to the skin because they are chemical compounds, and baby skin tends to be a little bit softer and gentler and more prone to irritation. So even though you and I might be able to get away with a chemical blocker, I think for the babies it's probably easier and just safer to use something that is zinc or titanium because nobody reacts to zinc or titanium for the most part.
Okay. We've got a question here. It says, I try to go outside each day to get vitamin D. Will sunscreen interfere with my ability to benefit from the sun's vitamin D?
So probably to some degree, yes. But you really only need maybe 5 or 10 minutes worth of sun for your like vitamin D like exposures. It doesn't really have to be like a prolonged thing. So if you've got sunscreen on, you're out the whole day. I guarantee you're going to get enough sun for your vitamin D needs. And then if you're only out for 10 or 15 minutes, you probably don't need to put on the sunscreen anyway, unless you're extremely, extremely pale.
Great. Okay. Um, Someone asked, can you put the slide up with the ingredients in sunscreen?
I have that
Oh,
up right now.
oh, great.
Yeah.
Thank you.
I think they just
Um,
wanted to see that ridiculous photo of me.
sure we do. Um, let's see. So I had a question regarding genetics. I know that you had said, if you have a family history of skin cancer, and then you're more likely to perhaps get skin cancer. Are there other like genetic markers? I think at some point I had heard that maybe a BRCA mutation also maybe made you more likely to get skin cancer. Is there any other genetic indicators for skin cancer, I guess?
Sure. So there are some skin cancer syndromes where patients will get, for example, like pancreatic cancer and melanoma, or they'll get melanoma, mesothelioma, and renal cancer. But those are relatively rare. There's genetic syndromes that people are born with where they get a lot of atypical growths from from their sweat glands and their oil glands and stuff, that will also sometimes feature lots of basal cell cancers or squamous cell cancers. But again, those are all very, very rare. And you would know if you had those because you'd be having 3 to 4 skin cancers a year, if not more. I would say for the average person, you probably don't have to think too much about the genetics unless you happen to know that one of these cancer syndromes runs in your family. And then the other way genetics kind of plays into it is if your parents had really fair skin and they were Irish with like red hair and green eyes, and you're Irish with red hair and green eyes, you're clearly at a decently higher risk of skin cancer than somebody who's African American with dark hair, dark eyes.
Okay. And then we have one more question here from our medical student. She said, "What do you like most about your specialty, and what do you dislike?"
No, I mean, dermatology is great. You get to work with all sorts of patients. you can work with adults, you can work with kids. I do like 50% inpatient, 50% outpatient. So it's a lot of like varied practice settings. And you see a lot of different stuff. You know, one patient could be here for a skin check. The next patient could be here for something as basic as like acne or eczema. And then your third patient could be here for like really severe systemic lupus or something. So there's a lot of like variation in your day-to-day clinic, which is always very fun, keeps things interesting. So yeah, I that's probably what I like the most about the specialty. And you know, I don't do a lot of procedures to your question, Tosin, but that's sort of by choice. There are procedural dermatologists who focus mainly on skin cancer surgery and procedural dermatology. That's just not, you know, something that I personally seek out, but we have 3 or 4 physicians here who do that.
Okay. And I'm just going to check our Facebook Live to make sure there are no questions there. That's the last question in our chat. If you have any other questions for Dr. Chadha, please put it in the chat, or you can unmute yourself if you're on Zoom and you can just ask him directly if you have any. I don't see any more questions on our Facebook Live. And I don't see any more in our chat here. So Dr. Chadha, thank you so much for all this great information. I don't know about the rest of you, but I'm going to go take a bath in sunscreen after this and kind of hope for the best. Really, this was such great. This was such a great presentation. Lots of great information about skin cancer and preventing it. Those images were just what we needed to kick off our summer here in Chicago. And I really appreciate you taking time out of your day and being here with us. So thank you again, and we really appreciate it.
You're very welcome. I hope it wasn't too rude of an awakening.
It was perfect. Thanks again.
All right.